Right, there we go. Perfect. And Lily, did you get a chance to confirm that the text and email went out with a reminder of the Botox links?
Yes, I received everything at 4:30.
Great. All right, wonderful. I just had one person who said they didn't get a Botox Bingo card link. So
I sent it, and then I actually included the bingo card yesterday as well, just to avoid any issues with today.
okay,
So
cool.
one of the others should have been received.
Good. Well, as we get started here, when we get closer to the start of the Botox Bingo session, then we will we'll go ahead and resend that link in the chat function.
Yeah, I just copied it, so I have it ready.
So good evening for those that are in there so far. We've got a lot of people that are flowing into our meeting right now. We just started it, so we're going to give it a few minutes for the attendees to start joining. As you guys are probably familiar with, we've got Zoom going on here. It's become a Zoom world. So there are some functions that you'll want to be aware of as far as the session is concerned. You'll be able to chat with us. We've got both myself and Liliana who will be available with the chat throughout the session here. We'll be able to screen questions and answer those as we can throughout the meeting. Again, we're having people just flow into the meeting right now, so we'll probably be about another 3 to 4 minutes here or so before we jump in and get started with everything. We've got Dr. Gangnes online here. You can see his lovely picture there. He's coming to us live from Oregon, Jacksonville, Oregon. And we've got Jan Meisey as well. Lovely Jan smiling away. I can see her in her beautiful pink blouse.
And the neck.
So it's hello to everybody. So give us about 3 to 4 minutes. And if you have any problems, any challenges, please utilize the chat box in order to communicate with us. And we'll get everything handled for you.
Hi, Chris. So we do have one question. I don't know if Dr. Gangnes wants to answer this once he begins. It is, why would one consider a Tca peel over a fractional CO2 or vice versa?
Well, they do different things. A Tca peel, and I only do light Tca peel, is a light chemical peel that's designed largely to remove pigmentation and give the skin a bit of smoothness. The fractional CO2 laser, however, is more penetrating. It generates columns of laser energy which vaporize skin, and it gets down, the heat gets down into the dermis. So you really get new collagen and tightening and reduction of lines and wrinkles with a fractional CO2. You don't get that with a Tca peel. So we do them for different purposes. Patients that have fine lines, wrinkles, want improvement in texture, that's a fractional CO2 or a fractional radio frequency device. Those who just want freshening of the skin, removing some of the sun damage, dyspigmentation, brown spots, and freckling, and that sort of thing, it's light Tca peel. The other thing is the light Tca peel is a procedure that can reduce skin cancer risk. Those patients that have precancerous changes that we see all the time in the Southern California sun, you can reduce those significantly with a Tca peel, not so much so with a fractional CO2 laser, depending on density settings and that sort of thing. So in fact, a dermatologic study came out over 25 years ago that showed that when you look at a Tca peel and how it reduces the numbers of keratosis in the skin relative to Effudex, which is the topical cream that dermatologists use all the time, they're pretty much equal. The Tca peel, however, done peeling in 10 days, you do it on the entire face. Aesthetically, the face looks good. Whereas the FUDX, you spot treat the face, and it's really almost a 6-week process. So there are places for both of those procedures.
All right. Thank you for that answer. I'm just starting us on Facebook Live right now, so it's running. Let's go public, and we are off. Perfect, and we are going live. All right. So on that note, we are about 5 minutes in here, so we're going to live stream this event all over Facebook, and then as soon as this live stream gets started, we'll jump into the meeting. So thank you all for attending. I noticed there's quite a few people that jumped in after we went through an initial introduction. So let me just give you a quick overview of things. So obviously this is a Zoom meeting. Inside the Zoom meeting, the best way to communicate with us is via the chat function. You'll notice in that chat function, you can just send us a message or raise your hand. Liliana and myself are the best people that can answer any questions during this, and we will be triaging any questions that you have throughout the presentation. Dr. Gangnes is going to be presenting here in just a couple of minutes after I introduce everyone, and if you have any problems, any challenges, then let us know and we'll get through them for you. All right, on that note, we'll jump right in here. So thank you for everyone for joining us tonight. We've got Dr. Gangnes as well as Jan Meisey that are with us, and Liliana, our lovely marketing associate that is helping us as well. So tonight is all about quick recovery facial rejuvenation. And so Dr. Gangnes is going to be discussing that throughout the evening. Now, tonight's agenda is first, I'm going to introduce you to facial aesthetic concepts, because we do have quite a few new patients that are part of our audience tonight. So we want to make sure you understand who we are and what we do. We'll then talk about our surgeons, both Dr. Richard Yanus and Dr. Brian Brandon. And then we're going to jump into Dr. Gangnes, starting off with a presentation about quick recovery rejuvenation. So he's going to go into some details about procedures, as well as a long list of before and after pictures that show some really tremendous results. If you can, please present any questions that you have throughout that presentation to the chat function. We will triage those to Dr. Gangnes for you on your behalf. And then after that, Jan, who is a recent patient of Dr. Gangnes, in her beautiful pink blouse over there, she'll smile in a second for me. I see it coming. There it is. All right. She will be doing a testimonial for us and tell us about her experience, because that's one thing that we find a lot of patients really have questions about. They want to know about not only just the results and the doctor and the questions about procedures, but also the overall experience that they can expect when they come to facial aesthetic concepts and the results they see after. So we'll follow her testimonial by a short Q&A session where you'll be able to have a chance to ask any questions you have of Dr. Gangnes. And then lastly, we will do our Botox Bingo. So you should have received an email with a link to your Botox card. If you haven't, there's nothing to worry about. We will be able to send you that link inside the chat box prior to starting the session. We'll make sure everybody has their cards ready to go before we get started. So on that note, we'll jump into a little info about FAC. So facial aesthetic concepts has been around for 40 years. It actually is no longer nearly 40 years, but actually 40 years this year. So quite some time around in Orange County. We are a UCI fellowship training facility. So Dr. Gangnes is a clinical professor at UCI, and he actually handles the cosmetic component of the American Academy of Facial Plastic Surgery fellowship program through UCI. And facial aesthetic concepts has also been voted the best of Orange County for 13 years. So we have been around a long time. We do a great job of taking care of patients. And our team consists of 2 facial plastic surgeons, Dr. Richard Yanus and Dr. Brian Brandon, both facial plastic surgeons specializing exclusively in faces. We also have 3 dermatologic specialists. That's Sharon Christopher, Cassandra McAsteve, as well as Haven Moorhead. They are all specialists in all things non-surgical with the practice. So they do all the Botox and fillers and all those fun types of treatments. We also have 4 medical estheticians, Nikki, Mary, Brooke, and Aaron, who are performing a wide variety of different facial services within the organization. So I'll just quickly give you an overview about the organization itself. So we have 3 offices in Orange County. San Clemente, Aliso Viejo, and Rancho Santa Margarita. We also have a HHC accredited surgery center, and this is where all of our procedures occur. So everything is all under one umbrella. So we have everything from the surgery center, the overnight suite, and the offices to take care of all of our patients' needs. So we do offer a comprehensive array of aesthetic services, both facial plastic surgery as well as breast and body contouring. So that's everything that may be performed for facial plastics, and really focusing on this concept of minimally invasive, quick recovery types of procedures, as well as many different types of breast and body contouring, including tummy tucks, liposuction and sculpture, breast lifts, arm lifts, and breast augmentations. We do a wide variety of non-surgical aesthetics, which is really something that has grown tremendously over the last several years. And that includes Botox, fillers, PRP, and many different non-surgical options for improving the look of the skin, the texture of the skin, and the coloring of the skin, or the tone of the skin as well. Lastly, we offer a comprehensive array of skincare service. So everything from facials to waxing and chemical peels and microneedling. And you'll see, I love this picture down on the bottom here. This is actually microblading on one of our staff members. So it's her brows before and then after microblading. So those are a number of different things that we offer within the organization. So jumping into our featured host tonight, Dr. Richard Yanus. He is a facial plastic surgeon. He is also a fellow gaucho like myself from UCSB. He went to Washington University for his medical doctorate, and he did his residency actually locally here at UCI. And so those relationships he developed at UCI have continued, and he is now clinical professor of facial plastic surgery at UCI. He is also a double board certified facial plastic surgeon. So he's certified by the American Board of Facial Plastic Surgery, as well as the American Board of Otolaryngology. We also have Dr. Brian Brandon. Dr. Brian Brandon is another facial plastic surgeon. He went to Cal Poly San Luis Obispo, so another local boy around here. He went to UC Irvine School of Medicine, as a matter of fact. So again, local in the area. He went across the country to the University of North Carolina for his head and neck surgery residency, and he's a board certified head and neck surgeon, as well as a fellow of the American Academy of Facial Plastic Surgery. So on that note, after a little bit of information about the organization and our surgeons, I'm going to go ahead and turn it over to Dr. Gangnes to get us going in this presentation.
Greetings, everybody. Every time I see that number 40 and now 41, I think, now, who is that? It can't be me, because I don't believe I'm that old, but here we are, started in the 1980s. I've been a low-profile surgeon in South Orange County, and I had the pleasure of meeting Jan Meisey a few months ago, and she asked me to help her out with a few things. And this whole talk came about because she, after surgery, said, I've got some friends who really love the way I look. Let's do a Zoom meeting. And I said, sure, fine, let's do it. And I said, if your friends are half as energetic as you are, I'd love to meet every single one of them. So that became this evening meeting. Chris came up with the notion of Botox Bingo a couple of months ago, and I said, that's great. And I said, I'd rather have a webinar and wine, but he said, let's do Botox Bingo. So feel free to pour a glass of wine and enjoy the evening, if you will. It's like Jimmy Buffett said, it's 5 o'clock somewhere, and it's about that time. So looking at what's transpired over the years, I thought it'd be interesting to show and discuss the evolution of the facelift, because I've pretty much done all the techniques that have been out there and described since the 1980s, and there's been a real evolution of change. And so our whole focus now is really on achieving very natural results with incisions that are virtually invisible in a way that has very quick recovery. So there's been an evolution of technique that we've adopted, coming up with the procedures that we're doing now. So when we look at the changes that have occurred, they began with the fairly aggressive procedures beginning in the 80s. And I've actually looked at some of my photographs from the 80s, and just doing the simple smash lifts actually produced pretty good results. I'm trying to advance this slide, and Chris, it's not advancing. There we go. So when we talk about really aging face medicine, these are the kind of things we look to achieve. And we hate to call them surgery, though, so we'll call them procedures for now. But I think first and foremost, we look at the lift as a primary procedure that we do that probably generates the greatest degree of improvement for what people are looking to achieve. Along that list, I would add fat grafting. And over the last 20 years, we've been able to harvest fat in different areas of the body and refine that fat and use it for volume augmentation in the face. And I think out of all the adjunctive procedures that we find, fat grafting has been one of the most important. Forehead lift surgery has gone through changes. Back in the 80s, we made an ear-to-ear incision. The focus was on cutting out scalp, and the patients had a vertical lift of the brow, which I think looked a little contrived. Then we developed in the early 90s, we came out with the endoscopic forehead lift, and we were able to achieve a much more natural results with the endoscopic because we realized what created a beautiful brow. And now we know that on the brow, it's not how high you make it, it's how you make it high. That a beautiful brow isn't one that is up to the top of your head. A beautiful brow is one that's shaped appropriately. And with the endoscopic forehead, we can do that. The skin rejuvenation with the lasers have achieved that component of things that the surgery doesn't do. In fact, we're talking about neck lifts. What the surgery does is it tightens the muscle, removes skin that has been stretched, but what it doesn't do, it doesn't create better skin, stronger skin, skin with greater elasticity. So let me move on to the next slide. So looking at the evolution of facelifts, and this goes back to what we're really the subject of the talk, and is that how can we get a good lift with a rapid recovery? So when we look at the early facelifts, it involved around tightening up the skin. And on the left picture here, what you see is a skin flap elevation. Usually with the facelifts, there are some degree of skin flap elevation back in the 70s and 80s, even the 90s, and some people still do it today. The skin is widely undermined. The next generation of facelift involved including the part of the fibromuscular layer of the face that you see here on the right. So as we evolved and we realized that facelifts to produce a natural result really required improvement and dissection of the fibromuscular layer. Get this down here as I advance the slide. It was what we saw with traditional facelifts. What you see on the traditional facelift, you see the vector of tightening of the skin was a more posterior direction. And what that resulted in is some disharmony between what you could achieve in the cheek and what you could achieve in the lower part of the face. And so what we recognize is that to achieve a vertical lift of the cheek pad along with the face, we didn't get the disharmony, and it produced a much more natural result. So the facelift that we're doing now revolves around lifting and separating the SMAS layer. And so SMAS, and you'll probably hear that term used other surgeons. It stands for superficial muscular aponeurotic system. And it's really a fibromuscular layer that envelops the platysmal muscle. I've got a slide of that in a second here. And that becomes the fibromuscular and fibrofatty component of the face. So the lifts that we've been doing over the last 25, 30 years involve not tightening the skin, but repositioning the fibromuscular layer. And the vectors that we use have changed over the years as we recognize that as you can see on the left here, the face descends in more to vertical oblique direction. So what we want to do is lift the face in a more vertically oblique direction. Trying to advance the slide here. There we go. So as we look at this slide, the problems with the traditional facelift was this disharmony. Along the jawline, it could be tight, but the traditional facelift did not cause release of the fibromuscular layer over the cheek. So as we recognize that, the focus then is to undermine not just the skin, but the fibromuscular layer of the midface to get midface elevation. So what we're really doing anatomically is triangulating the face. And the next slide. So this is a depiction of what the SMAS is. The SMAS starts as the platysmal muscle in the neck. It's invested with connective tissue. And as you can see, it goes up into the face. The muscle attaches to muscles around the mouth, and then inserts fibers into the cheekbone. So what we recognize now is that if we're going to get a good natural look in the face, what we have to do is work on that SMAS layer, which is the fibromuscular layer of the face. And various techniques have been evolved to achieve that, beginning with a deep plane lift that was described by a Texas surgeon back in the early 90s. And this is from his textbook, and what he did, rather than get under the skin, he elevated the fibromuscular layer. This depicts elevation of the muscle around the eye, the face, and then the cheek fat pad. Now, I'm going to be showing some intraoperative photographs. So I was always impressed with this photograph, although it may make some people squeamish. The next are his intraoperative photographs showing the elevation that he tried to achieve, that he did achieve surgically, and the resultant outcome. So this is the surgeon's fingers underneath the fibromuscular layer. You can see his ring finger is coming out through the lower lid. And again, I was always impressed with this in his textbook. And I thought, why would anybody do that? And he was well regarded, and I think he's abandoned a lot of these techniques at this point in time. But as we move forward on these slides, there are two more that are equally as impressive. This is advancing very slowly, Chris. And pause. There we go.
If you'd like to,
so
just
this is another
know
picture.
When you need to advance, I'm happy to do that. I can just take it for you.
Okay, yeah. So this, go ahead and advance it again. And to the last slide in this series, this is in his textbook. So this is a deep plane composite lift that was described back in the 90s. And a lot of us did it at that point in time. I did them. I was impressed. Go ahead to the next slide. I was impressed with the amount of time that it took this patient to recover. So this is the patient that you just saw a few minutes ago. This is early on. And as we go into the next couple of slides, you'll see at this patient, even at 3 months down the line, which is the last slide on the list here, you can see this patient is still bruised and has this bronzing effect on the skin and still swollen 3 months later. So in an effort to say not everybody needs that kind of lift, what can we do to give an equal good result and achieve a more rapid recovery? I started doing a limited dissection lift. And this is sort of a diagram of it. And rather than elevate the skin widely forward, my incision is inside of the ear, but the elevation just goes to that dotted line. And so with that elevation there, we can still elevate the fibromuscular layer through an approach behind that line. And then we can get into the mid-face to release the fibrous attachments. That's the extent of the undermining that we do. The other lines depict where the fibromuscular layer is and some of the deep muscles. That one that runs obliquely from the corner of the mouth is the zygomaticus major muscle. We stay on top of that, and the fibromuscular layer sits over that muscle. So we're able, we can go ahead and advance it. We're able, through this minimum dissection, to undermine, go ahead and advance, undermine that fibromuscular layer. And the next one will show you, after this one, what the fibromuscular layer looks like. It's that layer there. And so we elevate that separately as a separate plane. And that layer goes, we separate that into the midface. So the entire cheek becomes a myocutaneous flap. That is, it contains the muscle and the skin as a unit. And then the next slide, as we tighten that layer up, we get that, that vertically oblique lift without the dissection, without the bruising, and with a pretty quick recovery. So this is, the fibromuscular layer has been tightened. So the skin that you see overlying the ear, we're not pulling on that skin, that's just laying there. The skin has been tightened and the skin lays, and all we have to do is remove the excess skin with minimal tension on the wound edge. And that creates a beautiful incision that you really can't see. We'll go ahead and advance this guy and advance that slide. And so the amount of skin that has to heal down in front of the ear is less than a thumb breadth. So you can see without undermining the skin widely forward, we can achieve the same result. And this patient will look good in a matter of days and not a matter of months. So that was the whole focus of it. And then we've added some nuances to that to make things even better as we open up the neck, and we treat some of the deep neck muscles and get the neck tighter if that's what a patient needs. We can advance that slide. Go ahead, Chris. Okay, so if you see the dotted line now, do you see how far in front of that it is? It started way out on the left, and now that dotted line is back towards the ear, and the entire facial cheek pad and mid face has been elevated superiorly. We've had increased volume of the cheek that's triangulated the face. The jaw line will look well defined. And as we look at the jaw angle, our goal here is to define the jaw angle, because what happens as time goes by, you get blunting and of the transition from the jaw angle down to the neck. So what we do with the jaw angle, we refine the fat under it, and then we take some of the fibrofatty tissue that's excess. We don't cut it off, we use it, and that augments the mid face and augments the jaw angle as well. You can go ahead and advance the slide. So this was the very first patient I did 20 years ago when I did my first microlift. She did not want a big facelift, nor did I think she needed one. So I did a microlift on her. I think she's had nice improvement. She's had a good triangulation of the face, and she looks good 1 month after surgery. She actually had very little bruising. Even at the 1 week time frame, she looked very good. You go ahead and advance. I don't know if we have an oblique of her. I think we do. That's her oblique view. You can see just with the cheek microlift alone, the jaw neckline looks better. And also, if you look at her ear, the incisions are well hidden inside of the ear. The ear looks natural. In fact, probably looks a little bit better after surgery than it does before surgery. But she has a nice depression in front of her cartilage in her ear, and that's a normal configuration, a normal position of the tragus, as we call it. So go ahead and advance the slide. So we have some more examples of this. This patient is 48 hours after surgery. She had just a microlift. Go ahead. And that's 4 days, 40 hours, 4 days. Go ahead. And I don't believe we did not do a resurfacing procedure. There was no laser or peel on her. And that's at 7 days. So she's out and about here at 7 days. Now, if we do other adjunctive procedures, be it a fat graft or we resurface with a laser or peel, it tends to be a little bit more swelling. By and large, if you look at swelling over the course of time, about 70% of it is down by the end of the 3rd week, and then the rest of it's down over about a 6-week period of time. So I usually tell patients with a microlift that they're usually out and about in 7 to 10 days, looking lovely at the end of the 3rd week and beautiful at 6 to 8. That's kind of the course of things as we look at it. And if we add fat to it, there's going to be a little bit of swelling. We know that with a fat grafting, we lose about 50% of the initial fat volume. But the fat grafts that we put into the face as a structural enhancement and volumization of the face, that stuff lasts forever. So what you see at about the 2-month time frame is what you get. Although sometimes we'll get some increasing volume at the 8 to 10 to 12-month time frame because of the conversion of stem cells that we have in the fat to fat cells. So it's a long-term process with fat, and fat has stem cells that can also help rejuvenate the skin. Go ahead and advance the slide, Chris. So we'll go through some, and that's her preauricular incision. And that's a preauricular incision very early on in just a couple of days. And a little bit of redness for a period of time, and that just fades. And there's swelling of the tragus, and that refines out, like you saw in that previous patient, very nicely over time. Go ahead. So that's before and after. Go ahead, Chris. And this is also patient 5 days, 7 days, and we've got a pre-op of her And we did fat grafting in her. So you see yellowing around the eyes, and that's the resolution of a little bit of bruise because we put fat in there. The insertion sites fat are those little red dots next to her nose. That all fades away. We use very tiny cannulas for fat grafting. So we put droplets of fat, and we'll kind of show those cannulas in a moment here. Go ahead and advance. But I found that fat grafting gives us something that that lifts don't give us. When we lift, we flatten, tighten, and elevate. And most of us will the underlying bony skeleton change. It narrows. The eye socket gets bigger as time goes by, and so we dealt what looks like hollowing. And so fat is really a structural component of the face that when we graft it, it stays. It's long term, and that's for a month later. And then I think we also have another one long term as well in there. So, and then we can move on to the next patient. So anyway, so what we see is triangulation of the face. The fat helps us here because we did put fat in this patient. And you can move on. And so this is what we're trying to avoid. This is not one of my patients. Well, it was my patient after she had somebody else do her lip. So you can see these scars, elevation of the hairline, elevation of the temporal thinning, hairline thinning. These are really inappropriate scars. So the whole focus, and if you advance, it shows the one in front of the ear too. There's no reason for this. These incisions should be hidden well inside of the ear. And by doing meticulous closure, it's really tough to see these incisions at long term. So we can move on. So it can be a challenge to remove those scars because you have a scar there and change in the hairline, and it's always there. What we can do is make them better. Sometimes we can't remove everything. So this just depicts what happens to the skeletal. It changes as time goes by. It narrows, the eye socket gets bigger, and what starts out as a very full face then becomes more hollow looking. The eye socket gets bigger, producing hollowing. And so although we can't change the underlying bony architecture, what we can do is fat grafting. Go on the next slide. And so the fat grafting has a structural component to it. And this is the top syringe is how we harvest it. We do it by hand. I don't do it by machine. I like to be very gentle with those fat cells. The little cannulas down below are blunt. Those small syringes are loaded with fat, and it goes into the tissue, and it's a structural kind of a procedure that we build the tissue up from below upward into the skin. And sometimes we'll place fat right below the skin because there is a rejuvenative effect with fat. I find the patients are very lined and wrinkled, that have leathery skin. The best way to get that leathery skin smooth again is to tighten it. If there's been some laxity over time, is to put fat below the skin, immediately below the skin, and not so much the skin looks plumpy or full overdone, and then laser the skin. We can achieve remarkably nice improvements in the skin in these very leathery patients that have been out in the sun a lot, enjoy the Southern California sun by doing a combination of ingredients. Go ahead. So this is a depiction of the fat particles. That's a blunt cannula. It goes through the tissue, creates a tunnel. Then as you withdraw the cannula, we deposit droplets in. So, and those droplets get incorporated into the tissue. We do lose some because you take them from a bed that's well vascularized, it's get nourishment, it gets blood vessels, and we put them in an area that has to grow blood vessels. So we don't survive, all those fat cells don't survive. A lot of them do. We've done things like hyperbaric over the years, and that helps the fat survive. Since COVID hit, we haven't done much. We haven't done any hyperbaric because of the risk that we're concerned about, despite us cleaning the chamber. But when we get a handle on the COVID issues, we'll be going and doing more hyperbaric too, because I think there's value in it both for having the fat cells survive and for even more rapid recovery from facelifts. Go ahead, Chris. So this patient just had fat grafting and skin resurfacing. You can see that the infrabrow area on her upper eyelid, it's hollow. You can take fat and you can create a light reflect in the infrabrow area, which beautifies the eye. You can fill in the hollows on the lower eyelid, and with a resurfacing, it gives a better texture to the skin. So there's something to be said for fat grafting alone in some patients and along with skin resurfacing. Here's just fat grafting. We did lower lid pinch, and then we did fractional CO2. There's just a nice energy to her face now, and she looks good. She looks energetic, and she has beautiful contours. But you can see there's rounding of the fat. She doesn't look overdone. The infrabrow area has a nice light reflect. It's soft, it's smooth. The contour is projected forward, and that's what reflects white light. So it just enhances the eyes when fat is put in there. We didn't do any upper lid blepharoplasty. This patient underwent a micro neck lift, and we did some fat grafting in her as well, and a fractional CO2 laser. You can see that the neck muscles have been tightened. The jowl, she's got a nice jawline. The fat has softened her eye area. You can see where the lower lid has a prominence of the fat. We fill in that triangle with fat, and then we give her more rounding of the cheek, and just gives the face more energy. Go on to the next one.
And then Dr. Gangnes, we do have one question. It is, how long does fat grafting stay?
Well, the answer is that the fat that survives after the second month is the fat that's with you pretty much forever. And so we think that without hyperbaric, we get 40 to 50% of the fat cells surviving forever. With hyperbaric, it's probably about 60%. So the fat, I've got patients that I did fat on 15, 20 years ago. I see them back. Some of them are interested in getting a little micro lift to get tightened up, and that fat without question is still there. So it depends on how much fat we put in as the difference that occurs down the line. But usually the fat that's there and that survives after the second month is fat you get to keep. And that said, we still may get a little bit of change from 2 to 4 months, but then we get a little bit increase in the volume at long term, probably a stem cell related effect. So there's longevity with fat, and longevity in a way that you can't get with the fillers. I like what fat does. You can sculpture the face with fat in a way that you can't do with the fillers. You're probably, if you're talking about fine contours like lip, if you look at this patient, for example, there's very little demarcation between the white lip and the red lip. She has no lip line. That's a patient that we don't do fat to, but I can take a small amount of filler and put a little bead on the upper lip line, the philtral folds, Cupid's bow, and without much filler at all, I can make those lips prettier. And I would not use fat there. But the fat we put in her cheek is something that she's going to really keep forever. But not every single fat cell survives. But again, we get good longevity of it. If you look at her ears, you can see the incisions in her ears. Ears look very normal at this point, and nice jawline. And she's got good volume of her cheek as well. I did do an endoscopic forehead lift that allows us to decrease the vertical furrows as well. So this patient, more of a subtle change. She's already a beautiful woman. This just kind of enhanced her look. We did some fat grafting to increase that infrabrow fullness and projection to create that light reflect, soften her cheek areas, and tighten up her jawline in a very subtle way that maintains her essence and maintains her beauty. So that's what we're trying to do. I like patients to bring in photographs of themselves in the 20s, 30s, and 40s. And if you ask somebody to say, evaluate your photographs in every decade of life from the teenage years on up to your 50s, when do you think you looked your best? And the women will say, my early 30s. And the reason is that in the teenage years, the face is somewhat round, full, amorphous. 20s, you get good definition. 30s, we haven't seen environmental changes creating aging changes, be it the sunlight, smoking, tobacco, or whatever it is. And then we haven't seen the hormone changes that occur past the age of 30. So early 30s is the best. And those, I like to evaluate those photographs because we're trying to determine what the essence is. We're not trying to change anybody. We're trying to capture good energy and beautiful contours. Another patient, same thing, a fat micro lift. And go ahead, next patient. Another patient, sort of a tired look, the endo forehead. Again, this is a good example of when you talk about brow lifts, it's not how high you make them, it's how you make them high. And so in this patient, she doesn't have high brows. They look natural, and it should frame the eye in a beautiful way. We've also given her an infrabrow light reflect, which I think looks nice. And it captures that white light right below the brow, which highlights the eye. And she has a beautiful look. She's a beautiful woman. Go ahead. Another patient, similar. We've captured her essence and just has a soft look and more energetic look. The eyes on the left look a little tired. This is not a tired woman. This patient is full of energy. She's one of these people that when she walks in the room, the whole room lights up, kind of like Jan. The whole room lights up and with this beautiful smile. And we just sort of captured that and enhanced it a bit. Go ahead. Again, from the side view, you can notice the incisions again. Another patient. So this is a micro lift. Micro lift. I did a laser on her. And so you can show this just to look at the progression of what the skin looks like after laser. We do get some swelling with a laser. There's some heat imparted to the skin. So there's a little bit of swelling that we don't get if we don't do a laser or fat grafting, that sort of thing. So you can see at day 3, a little crusting. Day 7, she's pretty much all resurfaced. And day 10, this patient can be out and about in 7 days, even though she had a laser. It's better at day 10, and then at 3 months, she's got a nice rosy configuration. She's got a great smile. And we can laser the neck and chest as well. So this is early on, day 3, just to show what the laser does. The shine on the skin is the ointment that we put on the skin. In another 2 days, we can stop the ointment, and the skin actually looks pretty good at day 5. This is day 7, pretty nice and smooth. The pigmentation that she had before, pretty much gone, and she's got a nice smooth skin. And this skin after fractional laser continues to tighten and look better for months. You can see that the jowl area, jawline, again, a micro lift. This was not, didn't do the neck on her, didn't open up her neck, just she got that neck improvement with just the micro component of it. You can see her earlobes look normal. We sometimes make earlobes smaller, probably in about 50 to 60% of patients. But a nice jawline here, and the skin looks good as well. She just looks energetic, and I think that's what we're trying to achieve. And this is also a very, very energetic woman. This is also a patient. When she walks in the room, the whole room lights up, and she'll start telling jokes and having fun with everybody. So this is one of my favorites here. And again, those of you who know her know what I'm speaking about. So with that, this is Jan, and I see Jan's there as well. Hello, Jan. Thank you for joining us today, and thank you for suggesting this. It's so fun. So anyway, this was same thing, micro neck. You can see the neckline is tight, jawline is well defined. The skin looks good. What we did in Jan also is a lip lift. I like what the lip lift has done. If you look at the oblique view, what it does is it shortens the distance between the nose and the lip line, and the lip just looks more energetic in this photograph post-operatively. So what happens as time goes by is the lip gets longer in relative terms. As the bony mid-face shrinks in height and narrows, the lip really doesn't change much. You get some change related to the soft tissue and fatty loss, but the lip looks longer in relative terms. So what we do is we try to assess the aesthetics of it. We measure the lip, and the ideal measured in most women is about 14 to 16 millimeters from the nose down to the vermilion border of the upper lip. And if it's more than that, we start thinking lip lift. The other thing is that I wasn't expecting this when we started doing lip lifts. If you look at her vertical philtral folds in the lip and her Cupid's bow, the philtral folds after the lip lift are more prominent. And that's really a very youthful, energetic kind of a contour. So what I see is that those philtral folds look nicer. They look more natural. There's a slight more red lip showing. It doesn't look overdone. And it just looks more natural. It just looks natural. And so she has a lovely look to her. Of course, she was lovely to start. So all it is an enhancement here. And I don't recall, I think I might have made her earlobes a touch smaller as well.
Yes.
So if you look at the post-op, the height of the earlobe is a little bit shorter than the one on the left. And so earlobes tend to get longer in women, and a lot of women, because of what they put into it. The 10-pound weights, the hoops that we used to use tend to make the earlobes a little bit longer. And so I probably make earlobes smaller in 60, 70% of women, men too. Men have bigger earlobes than women. I will sometimes make those earlobes smaller. So it's the little things that make a nice difference in the rejuvenation surgery that we do. And the whole goal is here to have a quick recovery. I don't recall, Jan, when you first started going out, and because I usually say patients are out and about. That's not to say they're going to be go to a black tie event in 7 to 10 days, but generally they can be out and about to the store in 10 days. She had a combination of ingredients. She had the fat and she had the laser, a little bit more swelling than just doing a lift by itself. But anyway, I think she looked pretty darn good early on, at least. And Jan always said, I don't look myself early on because of the swelling, but I'll have her relate her experience to you. Yeah. And how did you feel about the whole thing going out?
So, you're right. And I have to say, Dr. Gangnes, you were 100% accurate from every step of the way. It wasn't, so the first 3 days, I wasn't winning any beauty contests. Let's just be honest. But that was the first 3 days. By the second week, actually by 10 days, I was out and about. And by 3 weeks, my friends thought I looked absolutely fabulous. I still felt swollen because of the fat transfer, but my friends, and most of them are on the call today, thought I looked really great.
Yeah, good. So
Jan, when you were considering getting a procedure, what were some of the factors that you took into consideration in choosing FAC and Dr. Gangnes?
So I would love to share that with you. How I found you is by Lauren Chandler. She's my esthetician for 20 years. And she has been doing lymphatic drainage on post-surgical patients in the South Bay for almost 50 years. So she has seen every facelift, every type of procedure from San Francisco to San Diego. She's very famous for doing post-surgery lymphatic drainage. And when I was talking to her about doing some, actually I just went in for a dog bite on my lip, and that's a funny story, but said, who would you go to? She said, the only surgeon I would trust in California is Dr. Gangnes, because you don't see his scars. And she was right. And so I've now known people that have gone to Dr. Gangnes 20 years ago, and remarkable. They've had the fat grafting, they've had everything else. But that's how I found you, was based on Lauren, who has seen everybody in Southern California. And she was just so blown away by his work. So I made an appointment, and I made the appointment. I went in because I lived in Zoom all of last year. And the terrifying thing about that is you see your face every single day. And that's a 59-year-old face going, rah, that needs some work there. So when I saw Dr. Gangnes, though, I went to see him just because I had a bite on my lip from a dog a couple of years ago. And I thought this would be a good time to fix that because of wearing a mask. And Dr. Gangnes was so sweet. He's like, is there anything else that we want to talk about? He goes, we could do a lip lift and kind of, soften that dog bite on your lip. I said, well, I'm doing this a lot in the mirror lately, and I don't even know what this is called. But he's like, oh, that's a micro lift, which is what he's talking about. And then he said to me, how do you feel about your neck? I'm like, fine. How do you feel about my neck? He goes, well, how about those lines? And I'm like, you mean these lines? And he's like, no, these lines. I'm like, my vocal cords? Sweetie, those aren't your vocal cords. He didn't say, sweetie, those aren't your vocal cords. He was nicer than that. But I'm so delighted because he was so kind and gentle. And yes, you did fix my ears. I had no idea I had Dumbo ears before. So thank you for making them cuter and smaller and tighter. But then, being, a thinner person, I was losing fat in my face. And so I did the whole shebang. I went in for the dog bite lift, and came out with a beautiful jawline. And I have to tell you guys, so this photo here is 2 months later. And that was right after the facial that I had with you. That's why I look all greasy and so on. I'm 3 months in now, and it just keeps getting better and better. It's more and more beautiful. And a funny little story, I can share this with you. I was pulling up into my driveway last weekend. I had a baseball cap on and my sunglasses on. And I was waiting for the garage door to go up. And a gentleman is pulling up on me on his bicycle. And he's approaching me like he wants to talk to me. And so I, roll down the window. And I don't recognize him either. He has sunglasses on and a bike helmet on. And he says, excuse me. He goes, does Jerry live here? And Jerry's my husband. I go, yes, he does. He goes, are you his daughter? What? Are you kidding me? And of course, then I recognized who that person was. I took off my glasses and said, Jeff, it's Jan. But my how I found you is through Lauren, who has seen every surgeon's work in Southern California. She only trusted you, and she's right. You can't even see the incisions anymore. No bruising after the surgery. The whole experience was, I would love to say, let's do it again, but we probably don't have to do it again. I'm delighted to know that that's the only fat that I want to stick on my body for the next 20 years. And as I say, it just keeps getting better and better. And I have to say, I'm not a person of low self-confidence, but I feel better. I feel more confident. At 59, I'm soon going to be 60. I get so many compliments, and I wasn't doing that for compliments. I was really doing it for myself. But the fact that it looks so natural, when I see people, no one says, oh, you look kind of weird, you've had anything done. I don't look like I've had anything done, other than when I see people, you look really good. Like, what are you doing? Are you exercising more? Are you juicing? So I went to you, Dr. Gangnes, because you have such natural results quickly, without bruising, without pain pills. No beauty contest for the first 3 days, let's be honest. But I'll be ready.
Thanks for this.
So I'm so grateful.
Thanks for
yeah.
Well, that's
Yeah.
outstanding, Jen. And that's one thing that, patients sometimes don't recognize. This isn't, this is all for themselves and how they feel afterwards. And what we notice so much is the patients having such a tremendous response to how their friends see them and how they feel on the inside from how their outward beauty shows through. So we really appreciate you coming out, spending the time here today. And if it's all right with you, I'd love to open up to some questions that patients may have of you, of your experience, if that's okay. And then also questions for Dr. Gangnes too. If anyone in the audience has any questions that they want to ask, if you could utilize that chat feature to jump in and ask some questions of the group here and see if there's anything that you'd like to go. Let's see here. Well, apparently some people will say that they have fat in lots of areas. They'd love to be able to move around. And we talked about some of the fat grab. There was another question as it relates to TCA and melasma. We had talked initially about a TCA peel versus laser, and which one of those would be beneficial for a client that suffers from melasma.
Well, I don't think melasma is well treated by TCA peel. In fact, the inflammatory reaction can even make it worse. So melasma can be a challenge to treat. So it depends on how deep the melasma is. And so we use a UV light to determine the depth of the melasma, whether it's in the deep dermis, superficial dermis, or whatever. But we're using the fractional laser now as a way of driving medication in the skin to decrease melasma. And to a degree, it's been working well. We also have more colorblind techniques. And by that, I mean the CO2 laser does develop a degree of inflammation, which we have to control when we're treating the skin, especially the darker skin types in melasma patients. So we have a fractional RF device and even microneedling. And with that, producing holes in the skin, then you can apply topical agents that actually get down to the dermis where the pigmentation resides, and you can lighten up that. So melasma is a challenge. I find that fractional laser or the just mechanical microneedling and the fractional RF device, which is a microneedling device that's attached to a radiofrequency generator, both of them can be effective given a pre and post treatment with topical agents.
There's another question as it relates to darker skin types or women of color and treatments that can be effective with that.
Well, it depends on what we're trying to treat. Now, again, we like when we say a colorblind procedure, what we mean by that is something that doesn't stimulate the melanocytes to create darker skin. And so if we're after, and again, there's sort of an open-ended question, depends on what we're trying to treat. If we're trying to talk about fine lines and wrinkles, generally we have to go with the colorblind procedures, which can be microneedling or fractional RF. So we do treat olive tone patients, and generally if I'm doing a fractional CO2 on that patient, I'll pre-treat them with topicals for a good month prior to the treatment. And then I begin the topicals within 5 or 6 days after the skin treatment. So we do have to be very careful with darker skin types. And so we have to evaluate the skin type. And if we have any concerns at all about post-inflammatory hyperpigmentation, it's always safest to do a test patch in the face. Treat it like we would if we were going to do the entire face. We do a test patch and then see what issues may arise by doing a small area of the face before embarking on the entire face. So darker skin types are more challenging. The Asian skin is particularly reactive to heat or heat-based treatments. So we have to be careful of the Asian patients too. They have a lot of olive tones, very reactive melanocytes. And so it's pre-treatment is a key in any of those patients, and it's just a matter of evaluation prior.
Okay, we've
Some
got a couple
patients I
of
won't
questions
treat.
here. We had a couple of questions that that popped up. There's one: in which order would you do your procedures? Microlift and neck lift first, or eyes?
So if you're talking about at the same sitting or two different sittings. So if we're talking about if a patient said, I need my eyes done, or I want to do one or the other, then what I like to do is assess the patient. Because if the patient has very tired eyes, that generally means that they may have a brow descent, that eye may be made more beautiful by brow lift and eyelid surgery. And then I look at the lower. I'd like to segregate lower, upper part of the face from the lower. Now, if I have a patient that I assess the lower part of the face, and despite how good I can make the lower part of the face, if their eyes still look tired, I'm not sure that we've achieved what we want to. So I'll tell that patient that we really need to do the eyes simultaneously. If, however, we treat the eyes and it is the eyes are very tired and it's better to treat the eyes rather than the lower face, I try to prioritize it. Are the eyes more important or the lower face more important? Or should we do both? Sometimes I won't do one or the other, because if I think that if we do the eyes and the lower face looks tired, I haven't achieved what I want. If on the other hand, I have tired eyes and I do the lower face and I know that patient's still going to look tired, unenergetic, I won't do it. I say, you've got to do both of them at the same time before, because I want the patient to have a good result, and I want a patient coming out of surgery saying, boy, I still look tired. So the answer to that question is depends on what the priorities are.
Thank you for that answer. There's another question. Is it better to do to consider rejuvenation when you're younger in your 50s, or wait until there's more of a quote decline in the face?
Yeah, I tell you what, I get that question asked all the time. And I'll tell you that I think the patients that have the best results are those who begin in the mid 40s to 60s, because you can take that patient and have significant, beautiful rejuvenation. You've turned the clock back 10 years, and that patient will always look better. The other part of that question is that you should do it when you want to enjoy the results of it. I can show patients just by putting hands on what we can achieve, and I'll say, is this what you want to enjoy right now? And if you want to wait 5 years to enjoy it, you wait 5 years. I'm not here to say you got to have this, got to have that. What I can do is counsel patients. I think the bottom line is, if you want to enjoy the results now, you have it done now. If you want to wait 5 years to enjoy the results, 10 years, then you wait 5-10 years. But I think overall, the patients that enjoy the longest lasting results are those who start thinking about this at between age 45 and 60. Those patients have the best result because they look so natural. The things that we can do will make them look good forever. And again, we kind of turn the clock back. If for math purposes, you take a 60-year-old, now they look 50. When that 60-year-old is 70, they're not going to look 70. They're going to look 55 or 60. So time marches on. But that 60-year-old now has enjoyed the results of that procedure for that 10-year period of time. So that's the thing to keep in mind. We always turn the clock back. Time marches on. We may impede the aging process to a degree because we make the skin better. We help the underlying architecture with fat graft and whatever we do better. And so I think it's better to start at an earlier age. But we showed some slides earlier about an 89-year-old patient that I did. And she, it took me a long time to agree to do her, but she was a full-time real estate agent. She needed fat grafting. She was very hollow. she enjoyed the results. But anyway, so age is not necessarily, but I would say who are the best, the ones who enjoy it the most, those patients who begin mid 40s to 60s.
Okay, great. We'll do one last question that we have here, and then we will jump into our Botox Bingo as a final event here. So the last question is, how long does a microlift last?
Well, again, in the same terms, the microlift lasts no less than any facelift. Again, because the term micro sounds like it's a minimal lift, but what we're actually doing is going under the fibromuscular layer in a way that you saw those more aggressive facelifts do. And so it lasts just as long as a more aggressive facelift because we're tightening up the fibromuscular layer, and it's all released in the mid-face. We get mid-face elevation with it. So don't let the word term microlift dissuade one, because the term micro, I described that because the early lifts I did had minimal skin elevation, and then I dealt with the fibromuscular layer off of that. So it lasts every bit as long as any other facelift in the world lasts. And when you look at it, again, if you look at it in terms of longevity, it lasts forever. So you could take, for the same reason that we talked before, you have a 60-year-old, now they look 50. When that 60-year-old is 70, they'll be 10 years ahead of the curve. So it's every bit as longer lasting, maybe longer than more aggressive facelifts, because those more aggressive facelifts that you saw with Dr. Hammer's fingers in the face, there's actually fat loss that occurs in those patients long term. And I don't see that with my patients, particularly when doing fat grafting. So the microlifts, we don't stop the aging process, but we certainly slow it down. And I think we turn the clock back 10 years.
Excellent. All right. It looks like we got another one. It's talking about, there's two questions as a component of this. Well, this is the last question. It has to do with PRF and utilizing PRF and the results from PRF, and as well as weight loss prior to a facelift. If it's beneficial to lose weight prior to considering a facelift, or to proceed with it.
I think let's talk about weight loss if you like. Weight loss is an issue. When I operated on people with heavy faces, and they say, I'm going to lose 30 pounds before the facelift. Should I do that? And I said, yeah, it's probably a good idea. When I see that patient back in 6 months and you say, how many pounds have you lost? Well, I put on 5 pounds. It's a goal, but I don't find that many patients achieve it. So when I'm dealing with a full face and a patient that may have a BMI that's high, what we're actually doing is there are compartments of the face that we can thin out and remove some of the fat. So it's not necessary to have weight loss, but if a patient is contemplating it and can do it, I think it's better to do it ahead of time. We do deal with some of the fatty compartments in facelifts, so you can have somebody who has a round face, and you can actually refine that face by what we do with the fat. Submental liposuction, I sculpt through the face. There are a couple of fatty compartments underneath the chin. We do work on all of those fatty compartments, so you can take somebody with a full neck, and we can reduce the fat and create a nice neckline. But again, if the patient says, yeah, I'm going to be losing 30 pounds before surgery, is it better? I said, yeah, it is. And 30 pounds, if you've got somebody who's been working out, eating well, and they've got a 30-pound weight loss, they're going to be healthier. Anybody who's working out and loses weight is probably healthier, blood pressure better. So it helps in every single component. The PRF, we use for both injection, and I was using platelets. I've been using platelets now for probably 15 years. And there is a place, I think, for platelets. What I found, however, in using PRF, I was using PRF underneath the skin flaps. And I don't use it anymore because I don't see a benefit from it, because we're using another agent that really reduces bruising and swelling. I do use PRF. We use it with fillers. I was putting it, I started using platelets probably 20 years ago with fat. And I had a platelet harvesting device, and I mixed it with my fat. I was trying to assess whether or not platelets and with an injected fat has increased viability with the fat. And I wasn't convinced that there was any increased viability. So then I began using platelets underneath my skin flaps, and I thought there was value to that. Then when the PRF came along, that's platelet-rich fibrin, there also may be the ability to decrease some swelling with PRF. I don't use it routinely. We have other agents that I think produce significant reduction in bruising and swelling, more so than the PRF does. So kind of gone away from PRF because I find other agents that are better for my purposes in facelifting surgery.
Gotcha. Okay. Well, thank you so much for all those answers and for the questions, everyone. There are a few questions. I'm sorry.
Yeah, I was thanking everybody for the questions.
Gotcha. There may be a few other questions that are still out there. If you do have questions, please, you can feel free to send those directly to me, chris@newbeautymd.com, and I'll be happy to answer any questions you have. You can also feel free to schedule a consultation to learn more about the procedures, as well as learn about any other options that may address the particular concerns that you have. And so that option is available. You can give our office staff a call at any point in time, and we'll get that taken care of for you. In addition, there's going to be, following the event tonight, there's going to be a little survey. That survey will ask you if you're interested in taking on a few questions that we have about the event tonight, help us out with additional topics you might be interested in learning about, as well as determine if you're interested in moving forward. And we will reach out to you to help you get that consultation scheduled. So our last thing here is Botox Bingo. So I'm going to do my best job of putting on a cheesy game show voice for you, and hopefully we'll have a little fun here. We have bingo cards that everybody has. So Liliana is jumping back in here, and she's going to help us out with making sure that everybody has what they need. You should have received an email that has a link to your Botox card. I'm going to go ahead and ask Lily. Lily, if you're on there, if you could please send that link to everybody in the chat box. There she is. All right. Thank you for jumping on here. If you could send that link to everybody in the chat box, you'll see it's a bingo card that comes up like this. Everybody has their own bingo card. So you'll see up in the top left corner there's a bingo card ID. That's your own personal ID. So what we're going to do here first is jump into a few rules that we have for Botox Bingo, explain how this thing goes on and what we're going to do here. So let me make that rule screen here. All right, so each player has one card. You'll use the link emailed or in the chat box to make sure you get your card and you have it on screen there. You're going to mark your card. You'll see the card on the right there has those little X's on it. As you see your numbers called, you'll go ahead and mark each of those numbers. And then let us know when you have a bingo. So when we are done, you'll click that little button on the top right corner that says reset for the second game. But make sure that when you win, you make sure that you get excuse me, I'm jumping back a little bit. You'll get the pattern that we call in advance. So in this first one, you'll see the line goes directly across the top there. That's what we're going to be looking for, is a straight horizontal line on any of the rows that are there. Each of the games will have a different pattern. And then when you win, when you get that pattern, raise your hand or send a chat message to us to indicate that you're a winner. So we can stop the game, verify your card. You'll give us your card number up in the corner there. We'll verify that it's a winner. And then we will go ahead and give you the grand prize for each of the game of 20 free units of Botox. So everybody loves Botox, right? I have myself, I love it. It's a great product. And so you'll receive 20 units of free Botox if you're one of the winners tonight. Now, there is a possibility that there may be multiple winners on one of the numbers. So in that case, we have a drum roll feature where we can actually do a tiebreaker, and one of those people will get a chance to win Botox, and the other person will win a consolation prize. All right, so on that note, if anybody does not yet have a Botox card, you'll see in the link in the in the chat button there, you can use that link to be able to pull up your Botox card. So what I'm going to do here is I'm going to get out of our presentation, and I am going to jump into our caller screen here. All right, so you guys will see we are going to go ahead and use this to call our game here. I'm going to pick, let's say, call sequence 21, because I wish I was 21 again. So what we're going to do is I'm going to go ahead and call these things out. You'll see BOT Heart X. We couldn't have two O's because that's just crazy. So we have a heart in there as well. So as I call them, be sure to mark your cards and we will jump in here. Any other questions that come up, please make sure you jump in the chat box there, and Lily will be helping us out. So all right, we're going to go ahead and start the game now. The first number is T38, T38. Next one is B15, B15. O22, O22. And remember, so what we're looking for in this game is we want this to be a horizontal line across your bingo card. That's what we're looking for. That's what this one is. The next number is B10, B10. B5, B5. T32, T32. X67, X67. Before we continue, I do need to let you guys know that as a bingo caller in a Zoom meeting, it is really boring. So I really need encouragement from everybody out there. Throw me a comment, throw me something, say something. I need that help. I need to be able to get some encouragement here. So please do that. In addition, if you can, please take a selfie of yourself playing Botox Bingo tonight, post it on social with the hashtag Botox Bingo, and you will be entered into for another chance to win free Botox in our offices here. So remember, selfie, and give me some comments. I'm not getting enough love out there. Jan, I appreciate it. Thank you so much. At least I can see your smiling face. So on that note, let me get to the next number, the B11, B11. You go X62, X62. As soon as that heart pops up, we're going to get a winner. Oh, let's see. Heart 55, Heart 55. Heart 49, Heart 49. Heart 56, Heart 56. Heart 30, Heart 30. I'm sorry, oh, 30, excuse me. I missed it. X70, X70. Heart 48, Heart 48. Heart 52, Heart 52. Remember, make sure you're marking all these numbers on your card and let me know. Send us a chat as soon as we get a winner. T39, T39. T44, T44. Well, I can feel a Botox coming here soon. B14, B14. Well, we got a hand raised. Tara raised her hand. Tara, if you could please do me a favor and send us a chat with your card number. Send that to the panelists here. We'll go ahead and verify if that card is a winner. So as we're pausing here, unfortunately, I don't have any cheesy music to play, any Jeopardy music or anything like that. But again, throw me some comments. Let us know how everything's going with everybody tonight. I hope that each of you is at least able to have a glass of wine or a cocktail while we're playing some Botox Bingo here. I unfortunately am still at the office, so I don't have anything in my desk drawer. I did not plan ahead this evening. So Tara, if you can, please give us that that bingo card. I do see that you raised your hand. If you are not intending to raise your hand, if you wouldn't mind, just send us a chat so we can continue on with the game. Oh, don't worry. If you've had a few cocktails and you mess up, we'll let you slip one time. If you go more than one time in an error, we're going to kick you out of the game. All right. So no, please, we're just having fun here. You got to, I wish we could show pictures. Jane, thank you for the comment. All right, Tara, we'll give you another couple minutes here a couple seconds here to be able to get that in. As we're going to continue to move on. We don't want you to miss out on this. Oh, there we go. All right. Thank you, Tara, for sending that on over. So we got card 017. 17. All right. And look at that. Tara is a winner. Congratulations, Tara. You are a winner of the first game of Botox Bingo. So Lily, if you would please go ahead and mark Tara down as the winner for this first event. We will be sending you a beautiful gift card for 20 units of Botox. So that will be coming out tomorrow. Thank you so much for the first one here. So again, everybody, what we're going to need to do is go ahead and click on that reset button up in the top corner. The reset button is right around there. You click that reset, that moves all your X's. And so this game, we're going to do it a little bit different. We're going to go for the X, as you see on your screen there. That is the winning Botox Bingo combination for this next game. It'll take a little bit longer, but I'm going to punch through the numbers fairly quickly. And then again, make sure that if you have an opportunity, now that we are paused between games, snap a selfie, post it out there with the hashtag Botox Bingo on either Instagram or Facebook, and you will be entered in to win a chance for another 20 units of Botox. Thank you, Andrea. I'm glad you're having fun tonight. And yes, she is a lucky girl. I'm kind of jealous myself. I need to get some more Botox. So again, we're going to go for the X here. Let's jump on in. I'm going to change our call sequence up. We'll change it up here. I'm going to let Jan go ahead and pick a number for us. So Jan, pick a number 1 through 100.
Heart 49.
No, not the heart, just the number.
Just 49.
Call sequence. Call
Sorry.
sequence 49 is your call sequence. How's that sound?
49.
Beautiful. Here we go. All right, we got a clear card, guys. Again, we're going for an X. Make sure you're marking your cards. Make sure you reset those things, and let's jump on in and get started. This is Jan's game here, so here we go. Let's see who wins it. Heart 55, heart 55. X74, X74. O28, O28. T31, T31. X63, X63. B6, B6. B7, B7. O24, O24. T41, we got T41. T37, T37. O21, O21. Heart 52, heart 52. X71, X71. Heart 48, heart 48. Heart 59 was skipped there, so we had heart 59 and B12. Remember, guys, we're going for the X. The X looks like, oh, this across your screen. So make sure when you get that X, you drop a chat, raise your hand, and we'll check your winnings. All right, X72, X72. Heart 47, heart 47. B14, B14. O27, O27. T34, T34. I can feel it. We're getting close here. X70, X70. T39, T39. Heart 50, heart 50. Oh, I can feel it. We just need to be O19, O19. B2, could it be 2? Heart 58, heart 58. This board's getting full here. It's got to be coming soon. B8, B8. B5, B5. B4, B4. B1, B1. X65, X65. Remember, as soon as you get that bingo, raise your hand, drop a chat, and let us know what your card is so we can verify and you can get your Botox. X67, X67. T45, T45. X68, X68. X69, X69. Come on, guys, mark those cards, would you? We got to get a winner here. 023, 023. T40, T40. T44, T44. 029, O to be 29 again. Heart 53, Heart 53. B9, my boy is actually 9 years old. B9. T36, T36. Oh, I see a check coming through there.
Oh, Rihanna.
Right. Let's take a look here. What do we got? Card 1015. All right, guys, this is the big drum roll moment. This is our last winner of tonight.
Yay.
Oh, Rayada, you're missing one here. So we need Heart 51 and Heart 49 to make this thing cross here. So it's got to go across the screen. Guys, remember, with this one, we are not doing the lines across. We're doing the X across the whole card. So we are still live, still playing. Everybody's in action. We need a winner out there. Here we go. Let's continue on. Thank you, Riata, for that chance. Let's hope you get it in the next ones here. 018, 018. 016, 016. Heart 54, Heart 54. Oh, uh-oh. Tina, you again. Here we go. All right, let's see. What's your card number, Tina? It looks like Tina is a winner. Let's see what we got here. And remember, guys, even if Tina is a winner, you can still be a winner also. Make sure you post that that selfie after our event tonight with your hashtag Botox Bingo, and we're going to be drawing winners tomorrow for that. So anybody that posted is in, and get your lucky chance. We've only got about 40. Oh, Tina says never mind. It was a mistake. So all right, we're still live here, guys. We are still alive. Here we go. Let's jump into this thing. I can feel it coming here. Heart 60, Heart 60. X61, X61. I'm going to move a little slower. That's X73, X73. I'm going to move a little bit slower because I can feel it coming. It's almost here. All right, T38, T38. Oh man, we got two of them raised now. Let's see. Sherry, send us that message. Let's check it out and see what you got. All right, Sherry, I just need that card number in the top left here, and we will verify that winner. We are almost there. I really hope everybody's having a good time tonight. I always like to have these events. Yeah, thank you, Jan. I need some enthusiasm. I really wish could have everybody on the screen all together, and we could all be there. But unfortunately, it's just things don't allow us to do it. So I do see that we've got that hand raised here. So it is Sherry. If you have a Botox or a bingo. Oh, Eleonora too has this. All right, so we got two people that are claiming winners here. Send us in that chat box. Send us those card numbers, and we will get it. We'll verify that and see what it is. Let's see. Oh, no bingo from Tina. All right, let's see here. We're waiting for it. Shelly, you've got us all on the edge of our seat, Shelly. I can't wait. I'm just dying here. The anticipation's killing me. All right, Shelly, looks like Shelly dropped her hand. You know what? We might still be going here, everybody. I think, Eleonora, will you please tell us if you are a winner or not? Tell us what that card number is, and we will double check that thing. It looks like it's coming through now. Oh, somebody's asking for the hashtag for the event, the Botox Bingo. Throw that into this. I'll put it for everybody here. Let me drop it into All panelists and attendees, here we go. Let's drop in the hashtag. So this that I am putting in there right now, Botox Bingo, really, oh, not Botox Bongo, but Botox Bingo. There we go.
Okay, we
Botox
have
Bingo.
the card number.
She sent her card number? All
Yeah,
right.
Sherry did.
Okay, what is the card number?
That is going to be 032.
032. All right, guys, here we go. Big drum roll. Let's see if Shelly's got it. Oh, we have a winner. Nice work. All right, there we go. This is Rose. Rose is a winner. Rose, nice work. All right, so who else do we have? I think there was one other person that had their hand raised. Do we need to check anybody else to make sure that this is the only winner? Was that I see that it was Rose in the chat there. So can you confirm that, Lily? I don't know where it came through.
I do not see a
Oh, no, Sherry. Sherry said it's 032. So nice. Sherry, you are the
And then-
lucky winner of Botox Bingo number 2. We've got one other individual that has their hand up. I want to just double check and see if that person, so that's Eleonora. Eleonora, if you have that winning card number, if you can send us to it, we will do a tiebreaker between you and Shelly. I'll give you a couple minutes to be able to do that. But in the meantime, I want to thank everyone for attending tonight. It was such a great event. It's always fun, always nice to be able to do something different, something interesting. And I do wish I could see your faces, but please share with your friends. Throw a hashtag out there of Botox Bingo. And then see if you can still be a winner for our event tonight. And I'd like to have a special thank you to Jan tonight for joining us, for helping us get this set up, for setting the idea, getting it together for us, and constantly prompting me, hey, I want to do this. This sounds like fun. So thank you very much for getting me going on this thing and making it happen. So thank you so much. Thanks for all of your kind comments about both Dr. Gangnes, about the practice too. So if anyone here has any questions, please, we will have a survey that'll be coming out momentarily. And share with us. Let us know what else you'd like to hear about. And thank you so much for the event. It looks like Eleonora has not sent that card in. Do you see that, Lily? Did you see
No.
anything in there?
I've not seen it yet.
Outstanding. Well, on that note, I am going to Sherry, aka Rose, for the game. All right, we will get you all set. So Sherry, we will have you set up in our system. We've got your contact information through the Zoom link. We will send you an email with your gift card for 20 units of free Botox. You can come into any of our offices. So Jan also said that she is would like to share her contact information. So Jan, I will go ahead and share that information with our follow-up email to all the attendees from tonight. Thank you again so much for joining us, and I hope to see you soon, Jan. It's been too long since
you know you will. You know
Yes.
you will.
Absolutely. So
I'm bringing in my husband next week.
yeah, oh, that's right. That's right. They have another one in there. So again, thank you, everyone. Thanks for joining us tonight. I'll go ahead and close out the meeting session. You'll get that that survey following the event. And thank you again for attending. We'll see you soon.
Thank you,
Have a
guys.
wonderful evening.
Bye-bye.
Okay, guys.